Awesome. All right, I'd like to welcome you all here today. My name is James Blessman. This is our environmental health chat from Wayne State University. This is our fourth or fifth environmental health chat from CURES. And CURES actually means the Center for Urban Responses to Environmental Stressors, which basically means that our job is to try and understand the relationship between the environment and health. We're very concerned for the quality of our air, the quality of our water, the quality of our soil, and I'm told I can't call it dirt. That's politically incorrect to call soil dirt, so don't do that, okay? Yes, and we even look at people and how we relate to each other. An issue of social stressors. And it turns out, that our environment is more important than our genetics when it comes to our health. So this is a very important issue. And my area of interest is actually social fitness, the last area. And I'm very interested in building better cities by building better citizens, which is why I wear this hat. I don't wear this hat to be cool. I think I am cool, but that's not why I wear the hat, right? So it just has my purpose and mission on it. So in any event, the way that we interact with each other is very important because the choices that you make determine what you're exposed to. For example, the things that you buy and ultimately throw away can end up in the incinerator, can end up in your air, right? The things that you buy and flush down the drain can end up in the water and end up in your drinking water. So the choices that we make can have influence on the things that we ultimately experience. And so it all becomes very important. In fact, we're going to have, on the issue of social stressors, we're going to have another event, a fantastic event, where I think we are raffling the Hawaii trip. That's going to be on June 16th. But anyway, so I'm here from CURES, and can we raise, the CURES people raise their hand? Yeah, those are all the fantastic CURES people who are responsible for today's event. So today, we're going to be talking about a very important area of nutritional fitness, if you will. Because, if I were to cut you, your body will find its way back. It will heal itself as long as it has the nutrients to put itself back together. So nutrients are very important. And the closer that stuff gets to you, in terms of the fresher, fresh is best, right? So what we thought we would do is have some discussions about community gardening. There seems to be a big interest in that, in growing your own fruits and vegetables, which is a very good thing. It's good for you. It's good for the environment. And so coming up first, we're going to have Jessica Robbins Ruskowski. Actually, you want to come on up here? And you need to keep your eye on this person because what she does, she's an anthropologist. Yeah. Means she likes people, okay? And so she's become very interested in the benefits of gardening, which goes beyond just the issue of the nutritional benefits. So we asked her to come and share some words. And so we're going to have 3 talks. Each one's going to be about 10 minutes. We'll allow for some questions and then some at the end, okay? So with round of applause, if we could welcome her to the mic, that'd be great. Thank you very much.
Thank you so much. Hi, good morning, everyone. I'm so happy to be with you here on this gorgeous spring weekend. We finally have spring in Michigan. It's so exciting. Thanks to you all for being here. So I'm Jessica Robbins Ruskowski. I'm a professor at Wayne State in the Institute of Gerontology and the Department of Anthropology. So my research focuses on the social and cultural aspects of aging. So as an anthropologist, I try to take a holistic perspective. So that means that I consider how various aspects of aging are related to each other, like everyday life, how people make meaning in the world, politics, history, and health. I try to look at how all those things are connected to each other. So one of my research interests is in gardening. Previously, I've done research in Poland on older people's experiences of gardening there, and currently I'm working on a research study here in Detroit about older African Americans' experiences of gardening and how that's connected to a sense of health, well-being, and place. So that's what I'm going to talk with you about today, about gardening and how it can be part of health and wellness. But before I get into gardening specifically, I wanted to talk about what we mean when we say health and wellness, because there's lots of different ideas that come to mind when we use those words. But I think it's really important for us to think about health in a broad way. So we could talk about health having 3 different aspects. So you could talk about physical health, mental health, and social health. So physical health is probably what first comes to mind when you think about health. How's your body doing? This can be a bunch of different kinds of short-term and long-term health conditions. Mental health is how we think, feel, and act, and how our thinking and moods and behaviors, what those are like. And then if we talk about social health, we can talk about what interpersonal relationships are like, how you relate to the communities that you're part of, and are you part of relationships and communities that are meaningful and satisfying to you. And so these, of course, are all related: physical, mental, and social health. So if you have trouble with physical health, that can affect your mental and social health too. Or improving your mental health can also benefit your social and physical health. So intuitively, we all kind of know this, and there's also research to back all of this up. And of course, any or all of these can be shaped by the kinds of environments that we live in, as the work that we do at Cures shows. So when we think about gardening then, I want to talk about how gardening can help to promote these different aspects of health and wellness. So at the physical level, gardening counts as a low to moderate kind of physical activity. So moderate physical activity is considered kind of when you have a noticeable increase in breathing and your heart rate. So it's something that you can do you can talk while you're doing it, but you probably couldn't sing while you're doing it. That's what one way to think about what moderate physical activity is. And so, as you know, being active is important for your overall bodily health. The CDC says as much as 2.5 hours per week of moderate physical activity can lower your risk for heart disease, stroke, diabetes, cancer, a host of other issues. It can also help to relieve pain from things like arthritis. Gardening is especially good at promoting flexibility and strength, especially because it uses the whole body. It's not just your arms or just your legs, it's a whole body kind of activity. Also, people who garden tend to spend more time gardening than people who do other kinds of activity or exercise, like walking. So if you're a gardener, it's likely that you won't just garden for 2.5 hours a week, but probably more than that. So if it's something that you like, you'll keep doing it. Of course, gardening can also be a source of nutritious food if you have a vegetable garden. This can be especially important for people living in places without reliable access to fresh vegetables or people without resources otherwise to purchase them. Another physical benefit of gardening is that it's something that can be adapted to people with various levels of ability or mobility. So it can be as hard and as challenging as you want it to be. You can work outside several hours a day, dig in the ground, or you can be seated and worked in a raised bed. So it's an activity that's very adaptable to whatever your situation is. In my own research, what I found is people attribute their own health to gardening. So when I spend time talking with gardeners, people say things like, "My garden keeps me healthy." "I am alive thanks to my garden." That's what an 85-year-old man in Poland told me about living with cancer for 10 years. He attributed his ability to live well with cancer was through his gardening. Another person said to me, "When I'm in the house, everything hurts. When I'm outside in the garden, nothing hurts." So it improves your own sense of your health. And there's actually research showing that your own sense of your health can actually affect your health. So if you think you're healthy, that can help keep you healthy. So on the mental health level, people report emotional and spiritual satisfaction while gardening. It's been shown to reduce depression and anxiety. There's one study that's shown that exercise that takes place in a green space has more mental health benefits than exercise that takes place in a non-green or less pleasant kind of environment. There's evidence that gardening is really good for people who have dementia. So it can help people with dementia sleep better, be less agitated, improve or maintain cognitive aspects of health. There's also another study, an experimental study, showing that comparing people's stress levels from gardening and reading, so both kinds of leisure activities, and people who gardened were less stressed afterwards than the people who were reading. They both helped with stress, but gardening helped more. In my own research, people tell me that gardening is kind of an escape from the stresses of everyday life. People have said to me, my garden is my sanctuary, or I go to church out there. People talk about it being a real escape from the hard parts of life. And so it's generally a very positive experience for people who do it. And people find it to be an optimistic kind of activity, because if you're planting something, you have to be thinking then about the future and thinking that it's going to grow, and you have a plan. And this kind of forward thinking is really important for shaping your mental health as well. And also people, as those of you who garden surely know, feel very proud of what they've done too. Because you can say, look, I made this grow, this happened. Or I and lots of other things made this grow, but you can see the effects of your work in the garden. And then at the social level of health, gardening promotes inclusion and socialization, especially in community garden contexts in which you might be talking to people gardening right along with you and develop friendships that way, build relations that way. In my own research, I'm finding that gardening promotes intergenerational relations. So grandparents teach grandchildren how to garden. People describe learning to garden as children with their parents and grandparents. So it's kind of a way of connecting the past to the present to the future. And you're more likely to garden in late life if you did it earlier in life, so it's an important activity to do with children. Also, as those of you who garden surely also know, you share plants and you share knowledge with each other, so the gardening itself is a means of forming social relations. And having strong social relations is associated with all kinds of better health outcomes. However, my research is also showing actually that even if you're gardening on your own, the social relations are still there in people's memories. So if you gardened at earlier times in your life, gardening can be a way to feel connected to people from those times in your life. One woman told me recently, gardening is my connection to my relatives. That's what it's about. So people have plants from their friends and family. I've met 2 women in their 70s here in Detroit who each have plants from a grandparent of theirs. One of these plants has been alive for over 40 years. And they think about that grandparent as they water the plant and as the plant blooms. Another woman has a Christmas cactus from her husband who died over 20 years ago. But in a way, he's still living on in this plant. So I've mostly talked about what gardening can do for you as an individual. But of course, there are also benefits to the health and well-being of the community as a whole, too. So it can bring people together. Neighborhood gardens can provide a space for people to connect with each other. They can improve safety and make the neighborhood more beautiful. And there's research showing that living in a place that you consider to be beautiful and green can improve and affect your health. So this is just kind of a brief overview, but I just wanted to say that there are many connections between gardening and health. So those of you who are already gardening, keep it up. And those of you who are interested, find a way to give it a try, because it can have a lot of benefits in many aspects of your life. Thanks for your time.
Are there any questions? Oh, come on. Thank you. Yes.
I think that'll be a great question for our next speaker.
Yes, that is correct. We're gonna come to that question in a second, okay? And we will answer that. Yes.
I've tried gardening, not with vegetables, but with flowers. And pulling those weeds, that's a stressor. A very, very, it stresses me out because you have to keep doing it over and over.
So actually, can I say something about that? So I wanted to comment on a couple things. First, the issue about the physical activity that is involved in pulling up those weeds, right? So as you live, your cells, right, they're going to the, for lack of a better way to say this, they're going to the bathroom all the time. And so they're creating a lot of waste in the extra spaces of your body. The more you move, you kind of squeeze those lymphatic spaces, and it's a way of purging your body of waste, which is why the physical activity, that's probably one of the reasons physical activity is so good for you. So you actually need to thank the weeds for being so good to you and not stress yourself out about it. That would be a very good thing. Tell them thank you. The other thing that is also very important, I want you to realize, is that being outside and exposed to the sun is also very healthy. It seems as though many people have low vitamin D levels, which have a lot of positive benefits. And so the more time you spend outside can be particularly good. And the other thing that I will say is don't overlook this issue about social relationships. There's a lot of study that now suggests that when it comes to longevity, the better your relationships, the longer you will live. It's better than checking your cholesterol or hypertension, all that kind of stuff. The quality of your relationships will determine how good you and how long that you live. Very important. Okay? All right. Are we good? Awesome. Thank you very much. Again.